in opposition, filling out a card, would like to speak. Angela Broussard.
I've come here several times, and I was armed with all sorts of data and research and examples from other states and patient testimony and just, loads of data. Me and all the other advocates. We spent months collecting it, comparing it, and it just, after a while, it just kind of dawned on us that none of that matters, because we're here in a committee right now discussing how to make it easier to donate and quicker to donate to politicians' political campaigns, instead of focusing on the problem, which is the failing medical marijuana program in our state right now. It's not flawed, it's failing. We're experiencing product shortages, and what contributes to that? Tight regulation. Our market is the tightest regulated in the state. It is nothing to be proud of. I don't care if we were first or second, we're last in patient satisfaction. We're last in prices. If you do not open the market up, that's going to continue like that, as we heard Representative Marino explain to us, until 2028. That's $60,000 extra they're going to make off my family that I'd much prefer to put towards my daughter's college education. We know those are little things that y'all don't have to think about. The whole premise of this law is flawed, because the more restrictive you keep a market, the more ripe it is for corruption. This isn't me talking. This is the Federal Bureau of Investigation. There are cases right now in Miami, in my opinion, corruption that is less prevalent than what is going on in our state right now, as we know what the problem is. And this isn't spaghetti dinners. Right now, we have a medical marijuana program owned by the largest contributor to political campaigns in the state of Louisiana. This isn't no spaghetti dinner. Sorry, I love spaghetti too. I'm Italian too, but this ain't the same thing, y'all. This is huge donors. This is big money. This is legislators and their wives, husbands, and relatives that own this. You're legislating your own monopoly. It's not working. Patients are telling you you're trying to shut us up, but we're going to keep coming, even though we cry every night before we come here. You are not making it easier for people who are trying to pull themselves out of opioid dependency. And yes, it's all related, so do not attempt to shut me up right now. It's all related. Because the minute you regulate the market to this degree, all you're doing is inviting corruption, like we see right now on front display. We're discussing a law about how to make campaigns easier to get and quicker before we've even agreed to expand the market, when we know that's the problem. End the monopoly, expand growers, expand dispensary owners, and allow home grow to make up for the problems you've caused patients. All the bills this session have been to further stigmatize us for using a medication that we have every right to use. By further regulating the market, you're adding to stigma. And the other bills this session really don't help in that respect either. And y'all should be ashamed of yourselves for allowing this to continue despite the cries from the public for help. House note level marijuana prices, that's nowhere in the country except for good old boy Louisiana. Legislator-owned monopolies, that's nowhere in the country except for good old boy Louisiana. Are we going to do something about it? Are y'all just going to listen to your puppeteers, your donors? Yeah, I'm sorry, but we're angry and we're tired of putting up with it, and we're not going to put up with it anymore. We're done.
She does. Okay, Representative Ivey for a question. Hold on, Representative
I'm
Ivey.
sorry, I get a little heated about this because I speak to, as a patient advocate, I speak to mothers of children who are undergoing seizures more frequently right now because of product shortages that are caused by intense regulation and monopolized markets. So I'm sorry that I'm angry and upset.
Well, first of all, I appreciate you coming. I've known to have been become a little heated myself in some of these debates. Our program is fairly new, and so I think we've tried to be responsible, and maybe as a more conservative state, we've not rolled out the programs as quickly as people would like, and based on the needs. But I believe we've done a lot. And do we need to do more to provide? Absolutely. But it's many of us who believe that medicinal marijuana is absolutely necessary. On the other side, want to be very responsible with the regulations. what are your thoughts on? Is it the demand? Do we need to prioritize the distribution of that?
The thing that we could do this session is open up anyone currently growing an industrial hemp license to allow them to grow medical marijuana THC. Some of them do that in a greenhouse. Some of them do it on land. That would expand our program immediately and immediately bring more marijuana on the market and bring our prices down, the basic concept of capitalism. Secondly, we could add 200 dispensaries in the state so that people aren't driving 2 hours to go get their medication. Can you imagine if every time you needed heart medication or, I don't know, Viagra, that you had to go drive 2 hours, wait, stare at everybody just like you who's been explaining themselves for months why they're on marijuana, sitting there? I'm not faulting the pharmacies either. But you know, we're already stigmatized enough, and we're tired of explaining why we deserve to be treated like other patients. Just like my son has asthma, just like he deserves to use his inhaler at school. Children in Louisiana schools deserve to have their tincture drops to immediately stop their seizures. Right now, mothers have to check their children out of school to give them a tincture.
Right.
I mean, why aren't we doing laws to protect patients instead of protecting political donors? If you want to protect political donors, go ahead and add that into the bill that expands the market this session, which, you know, nobody really wants to talk about, surprisingly.
Well,
nobody wants to answer if
thank-
it's expanding or not, do y'all?
Thank you. And again, this is House and Governmental, not Health and Welfare, which is a different subject matter. But thank you for your time.
You're welcome.
Thank you, Representative Ivy. That
Thank you, members. I appreciate the discussion.